name is Dr. Minto Bain. I'm the gynecology doctor, the fertility specialist here at Trinidad IVF. I'm also the medical director, and I've been running the company for the past 6 years. We've been in operation for 18 years now, so the first baby was born in Trinidad back in 1996 through IVF. So it's a long, long history we have of providing fertility services in the Caribbean. So when you're having a problem with fertility, what you need to do is get properly assessed. And that includes both the male and the female being assessed. So when you're choosing a fertility centre, you're looking for somewhere that offers tests that cover both of you, so you can be thoroughly and properly assessed. In Trinidad, people tend to, if they think they have a male problem, they go and see a urologist. If they think it might be the woman, they go and see a gynecologist. But you'll find a big chunk of things might be missed out, and that's what a fertility centre does. It sees you both as a couple and uses the latest tests and the most up-to-date and proper tests to assess you both and work out really what's stopping you from getting pregnant. And then the question is, what options do you have moving forwards? What are the options you have for trying to get a baby? So when you're choosing a centre, you want to look for somewhere up-to-date, that has the right tests, that is able to offer everything that you need, and that has all the treatment options that you would want as well. And that's what we have here. All the treatment options that you would get abroad, they're all right here in Trinidad, and we have the latest tests. We have 2 centres currently, one here in Port of Spain, and then our main IVF unit where we have our IVF laboratory and theatre and a clinic, outpatient clinic, in St. Joseph and Medical Associates Hospital. So we're here primarily for Trinidad and Tobago patients, and we keep our costs as affordable and low as possible, primarily for Trinidad and Tobago. And so you will see that our costs are lower than you would be paying in the US and the UK for most tests and treatments. But we do get people coming into us from other countries. So a lot of clients, about 15% of our clients will come from other Caribbean islands. Antigua, St. Lucia, St. Vincent, Grenada. And we get a fair number of people also coming in from Guyana, Suriname. And because those countries don't have fertility services available to them generally. We also do get couples coming in from the US and the UK, so we are available for overseas patients. But our prime role is to provide an excellent service for our local population here in Trinidad and Tobago. Any health centre or any business has to set its own standards. And we believe that you have to work to the highest standards, but that has to be in a fertility setting. You have to do things to the very best standards. But it's not good enough just to say, I'm going to do it this way and I'm going to make sure I watch myself and all my staff and that we're going to do it very well and we're going to have excellent standards. You have to have somebody else come in and check your clinic and check your standards. And if you don't do that, you can't be sure that you're not missing things. You can't be sure that you really do have the excellent standards that you would get in London or Miami or New York. So you have to have some independent body that comes in, and they have to know all about fertility and IVF, and that's accreditation. It's a body that you choose to go to, so you can go to authorities in the US, Canada or the UK. And around the world, the UK has the very highest standards. It's the most regulated place for fertility, and that makes it the best in many, many ways. So we choose to be accredited by a UK body called Quality Healthcare International. So they're an international body, they go around the world, but they use the UK standards that fertility clinics have to adhere to get their license to practice. And so we put ourselves through that accreditation process. And they come into the clinic and they look through absolutely everything, from the IVF laboratory to the staff, to how we treat patients, to confidentiality, all of the vital things to make sure that we are as good as, if not better than, most of the clinics in the UK. So we know that we are doing everything to an excellent standard, and we know that when you come to the clinic here, you will get the same standard that you would get in the UK. And they also pull up little things that we might want to change in the clinic, things that they might suggest that they're seeing in other clinics that we might want to bring in here. So they give you a full report which helps you move forward and plan how you're going to improve over the next 5 years.